Hey everybody, welcome to my channel. My name's Coach Kathy Richardson and I've lost 150 pounds. And it turns out I learned a few things along the way. And that's why I created this channel and started becoming a weight loss coach, because I saw that there was a need for people who wanted to take what they heard from their doctor, whether it was an obesity diagnosis or that they're overweight or morbidly obese, and then trying to figure things out at home. There's a big gap there, and I'm here to fill that gap with you. So let's get started. We're going to do today something that I like to call a cat chat, and we're just going to have a little discussion today. So grab a tea, grab a coffee, hit that pause button, and come on back. And if you're ready, then let's go. So today I want to talk to you about something that is hotly debated within the diet and health and fitness industry, even though it's already been put to bed by the American Medical Association. And that question is obesity a disease? And so we can emphatically say now, yes, obesity absolutely is a disease, and it's been classified as such. And not only is it a disease, it's actually chronic, progressive, and there is no cure. So here I sit in front of you today with a BMI of about 19.5, and I'm wearing a size 4 pair of jeans, which is awesome. However, I still am considered an obese patient, and I always will be, because my BMI used to be over 40. So I know BMI isn't actually the best indicator of whether someone is a healthy weight or whether they're healthy or not. But when it comes to classifying someone as being underweight, normal weight, overweight, obese, or morbidly obese, we do rely on the BMI scale. So just know that it's not always an accurate reflection. It does not show muscle mass or bone density or different things that can kind of skew that a little bit. But for all intents and purposes for our discussion today, we're going to refer to it a little bit. So with the BMI scale, if you are 18.5 or under on the scale, you're actually considered underweight. And so a normal healthy weight, according to the BMI scale, is 18.5 to 24.9. And that is right where I'm falling in. I'm falling in almost in the middle of that. So I'm about as normal can be. And don't tell anybody that knows me, because they would probably tell you I'm anything but normal. But anyways, you're considered overweight if your BMI is 25 to 29.9, and you actually enter into obese territory from 30 and beyond. And so there is one more classification, which is actually 40 and beyond. And there was a time in my life when I absolutely was, and that was when I tipped the scales at over 280 pounds back in 2018. That's the last time I weighed myself. That's the last time. That was the highest number I saw. I know I went above and beyond that, but it scared me so bad I just stopped weighing at that point. So I fell into the group of 6 million Canadians that are considered obese. And in America, 42.8% of all adults are obese. And by 2030, it's actually projected that 50% of all adults will be obese, and 25% of those are actually going to be morbidly obese. So guys, this is a huge, huge, huge problem. It is an epidemic. We are in an epidemic of this. Imagine if we treated obesity with the ferociousness and the grave concern, and like we have other diseases recently in the past 3 or 4 years. I think things would probably look a little bit different. But unfortunately, it just keeps getting worse. And fortunately, through science, we are learning more and more about obesity. And I do think classifying it as a disease was a major win. But that's not all there is to it. Obesity is a multifaceted disease. There are many, many, many factors that go into determining whether a person is going to be obese or not. And so a lot of people, especially I find on the health fitness end of the spectrum, that like to argue that it's not a disease, they like to just classify it as, sloth or gluttony. And, this is just a problem of overconsumption. And this is just people having too many calories going in and not enough calories going out. If that was true, we'd have a lot less obese people. And we're finding out through studies like the one I'm about to cite that, you can take a large populace of people and have them all do the exact same thing for exercise, and they can all consume the exact same amount of calories, and they can have very different outcomes. So they actually did that. There was a 2-week study where participants were given 1,000 additional calories per day. And at the end of 2 weeks, they saw who gained and who didn't. Some participants, just in a 2-week span, actually gained 12 additional pounds of body weight just in a 2-week period. And some only gained 2 pounds. They all did gain with the 1,000-calorie surplus, but some gained 12 and some gained as little as 2. And that leads us to why. And it's because we are all different. Genetics make us different. And it's actually the genetic component of an individual that is the biggest factor determining whether they're going to be an obese individual or not. And this is right out of the womb, guys. There are epigenetics which come into play, and we're learning more and more about epigenetics all the time. And that's basically environmental factors that can determine our genetic makeup through life. But basically, it really does come down to the genes that you were born with upon birth. Some people right from the get-go were predetermined and are predestined to have a bigger battle with obesity than others. And so let's talk about why some people can eat the same thing and some gain and some won't. So there's a little thing, and we're going to get a little sciencey right now, called lipoprotein lipase, or LPL for short. And so what this does is it actively pulls out triglycerides from the dietary fat that we eat, and it shoves it into fat cells called adipocytes. Some people are very, very, very efficient at their body pulling those triglycerides out and shoving them into their adipocytes, and some people aren't. And the difference is the overweight people are very efficient with their LPLs pulling out the fat and pulling out the dietary fat and shoving it into their fat cells. And so fat cells are kind of like Goonies. They never say die. Here's a hard, cold fact. And this is why I am still an obese patient, even though I do not have a BMI that is obese anymore. You never, ever lose fat cells unless they are physically removed from you through liposuction or physically cut off of you during plastic surgery and skin removal. So adipocytes can always increase, not only in number, but they can increase in size. But once they've been created, they never go away unless by those 2 surgical means that I was speaking about before. So they do shrink though. And so that's why a person like myself who has never had plastic surgery, I've never had liposuction, I have all those fat cells that I still had when I was an obese person. And not only that, but they want to become fat again. So the battle to remain a healthy weight and to not become an obese weight again is 10 times harder for somebody who was obese previously or for someone who is still currently obese. The reality is it's easier for a fat person to remain fat. It's harder for a fat person to lose their fat. And once a formerly fat person stays formerly fat, their body is always wanting to go back to being fat. That makes it seem like it's hopeless, but it isn't, because we do know the factors that contribute that contributed to our obesity in the first place and what we can do about it. And ladies, sorry, but we are more efficient creators of LPL. We have more of the fat cells that produce LPL around our bust and our hips and our thighs. Guys, you do this more in your belly, but women actually are more efficient and create more LPL than men even do. That's why when your husband decides to, just cut back on a few calories, he's dropping 10 pounds while you've probably gained 2 while you were dieting. So we do have cards stacked against us and our gender a little bit more, unfortunately. And like I said before, obese people have a much higher LPL activity than thin people. So if you're obese, your body not only wants to stay obese, it wants to get more obese. And when we lose weight, as if it wasn't bad enough, when we lose weight, LPL goes up because our body's like, I don't want you to do this. The body always wants to remain in a state of what's called homeostasis. And that's just kind of like everything staying level or it's okay with us gaining, but it really, really buffs against us losing. But we know this. And fortunately, we do know that time and consistency and a decrease in calories overall can gradually lower what we call a set point. We have a place, and if you've dieted even for a minute, you know this. There's a number or a level that your body likes to stay at. For me, it was 250 pounds. I was awesome at losing weight, and I could get down to 250, and I could maybe see 245 or even 240 for a little bit, or even when I did the 75 hard program, I got down to 235. But the minute I relaxed even a little bit or didn't exercise like a maniac and diet strict keto like a maniac, that weight would come flying back because I would just give up. I wasn't putting in the time and the consistency. I wanted fast. And we know now if it's fast, it doesn't last. And that slow is the way to go. Slow allows our body to gradually get used to that new set point. And then through time and consistency and, further calorie restriction, slowly lowering that gradually, then we have a new set point and another one. So we can slowly walk down those stairs of lower weights. But it does take time and it does take consistency. And sometimes it takes a multifaceted rounds of interventions above and beyond our diet. But let's go back a little bit to why I became obese, and maybe my best friend who was the same height as me, we ate very similar things and we're in all the same activities together. She never became obese, but I did, and quickly. If you watched any of my videos, you've probably heard me say that I didn't just gain the freshman 15 in university, I gained the freshman 40, and then I just went up from there. But that's because I was genetically disposed to obesity more than she was. That, again, is the biggest factor in determining on whether you will be obese or not. But there's even more than that. We're learning now that even what we have for a gut microbiome plays a huge factor in whether someone is obese or not, to the point where they've actually done fecal transplants in obese individuals and given them a little capsule of fecal matter from someone who has never battled obesity. And when they ingest that, they're seeing in studies now, this is actually happening, that alone, if they don't change any other factor, those people are losing weight. So the gut microbiome was a big part of it. We know that stress jacks up cortisol production. Cortisol production jacks up ghrelin production. Ghrelin is the little gremlin inside of us that tells us to eat. And stress is not just, I've got a deadline at work, or, I'm nervous about how I'm going to pay these bills. There's also environmental stress factors. And even electronics increase cortisol production. So we've never been more technologically advanced. We're on our devices all the time. And some people like to blame us being sedentary because of that. And that's why the weight increases. But it's actually the cortisol and stress factor. Also, what a time to be alive, right? You can drive down the road and you could get anything from a drive-through margarita in some states to anything you could think of at Tim Hortons, some of those ice caps, they have the equivalent of 14 teaspoons of sugar, and many of us are having 2 or 3 of those a day. So that's very difficult to combat for someone even who has a food addiction. You can't even go to a hardware store. There's candy in front of the aisles, even at the hardware store. We don't need to buy Snickers when we're buying nails for a project. But if you're aware and you actually start looking at where food is available, it's available everywhere. It's never been easier, cheaper, or faster to obtain food ever in the history of the planet. So that's a huge factor. Childhood trauma is also another factor, and that does come into stress and different hormones and whatnot. But childhood trauma, when you get unpacking why some people became obese or why they eat or why they're self-soothing with food or they're self-medicating with food, 90% of the time it's going back to trauma and childhood trauma specifically. Some of us are more hormonally driven than others to eat. We have menopause and perimenopause, and just the difference between females and males. Like biologically, we're different. We're very different, and that isn't allocated to not hormones. So hormones make a huge difference in why we're driven to eat. And here's a big one. This might be the newest hot topic in weight loss. It's sleep. And that goes back to electronic use. When we all have a phone shoved in our face, it's messing up our circadian rhythms. It's filtering a bunch, or our eyes are filtering a bunch of blue light, which actually tells our brain that we need to stay awake, and it stimulates us. So if you're laying in bed at night scrolling through TikTok on your iPhone or your whatever device or your iPad, you're actually really telling your brain that this isn't time to go to sleep. And even if you feel sleepy, your brain might not ever enter rapid eye movement or REM sleep, which is when cortisol production goes to the lowest and when fat metabolism happens the best. You're actually making it much, much more difficult for yourself to lose weight by compromising your quality of sleep, which then also compromises your quantity of sleep. So it's not just the number of hours, it's the number of quality hours in there. And they actually did a study on animals where the only thing they did was deprive them of sleep. All the animals got the same amount of food that they'd had for the month previously when they were studying them. And then the only thing they did was decrease their sleep. Every single animal in that study gained weight just because their sleep was reduced. So it's something to think about. So you'll notice on this list, the one thing I didn't say that contributes to massive obesity is lack of exercise. We're learning now that exercise has very, very, very little. Debates go on from anywhere from the exercise and its impact on your weight loss is as little as 7% and maybe as high as 20% because of the amount of exercise being done and the type of exercise being done. But really, overall, in your big 100% picture of why you are or aren't losing weight, movement and exercise it's down there. It's almost nothing. That doesn't mean we shouldn't do it. Exercise is awesome. Exercise can prevent all kinds of different diseases, and it can stimulate serotonin production and dopamine production. It's good for our mind, body, and soul, but it is not what is going to be the difference of you losing weight or not, and it's certainly not why I lost 150 pounds. So now that we have that out of the way, let's talk for a minute, and this is a little difficult to talk about, but what happens if we remain obese? We were learning why we're becoming obese, and we're learning how our bodies are working against us, but if we know all this and we don't do anything about it, where does this lead? It's not a road you want to go down on. This is going to lead to type 2 diabetes and coronary artery disease. There's actually 5 cancers specifically that are linked just to obesity now. If you're a female, it could lead to polycystic ovarian syndrome. It could lead to osteoarthritis, obstructive sleep apnea, high blood pressure, GERD, which is gastrointestinal reflux disease. And then those can all lead to tertiary diseases. So obesity is a disease that leads to secondary diseases, which can lead to tertiary diseases. It's compounding. And again, it's progressive. Nobody becomes obese and then that's their only disease and they just stay obese and life is fine. No. It's a constant downward spiral of your health, and it's going to compound, and it's going to make more and more diseases, and your body wants to become more and more obese. So we've got to get off what I call the crazy train. So can it be controlled? Yes. It can't be cured, but it can be controlled, and it can be controlled very well. And there's basically 4 main ways that we're going to be controlling our obesity. And number 1 is the biggest one, and it's the most obvious one. It's through lifestyle and behavioral changes. And when I say behavioral, I mean we need to do the work up here to see the results down here. So this is going to include maybe some therapy and definitely talking to your doctor about seeing someone. It could be talking to your registered dietitian who can then put you with a therapist. And it absolutely includes a weight loss coach. I play a huge part here. There's so many things that we need from a weight loss coach that our registered dietitians and nutritionists and our primary care physicians just don't have time to do. They're going to tell you that you need to lose weight. They might give you a couple of pointers on how to get that done, but then they're going to shove you out the door and they're going to be like, good luck, see you in 5 months, hope you've made some progress. And if you haven't, then you're coming back with guilt and shame and dread and maybe a secondary disease. And this doesn't end well if we don't stop this in our tracks. So yes, we need to deal with the behavioral aspect of it, especially if you're an emotional eater, especially if you have disordered eating, especially if you have emotional eating. These are all things that can be dealt with by professionals and a weight loss coach. And so there are lifestyle changes absolutely that need to be made. We really need to not only talk about how much you are eating, but what you're eating and why you're eating it. So that's definitely where someone like me comes in. So then the next option is, in addition to that, you'll always need diet and lifestyle changes, no matter what, if you do any of the other things I'm about to mention, because you can't out fast a bad diet. You cannot out exercise a bad diet. You cannot out medicate or shot or Ozempic a bad diet. You cannot out surgery a bad diet. There's all kinds of ways and mechanisms and multifaceted ways that we can combat obesity. But if you continue to overeat and overeat very bad foods, you are always going to remain obese, which will lead to morbid obesity, which is going to lead to all of those diseases. So yes, lifestyle and behavioral changes, number one, and always, regardless if you continue on and do anything else. There's different devices that you can have implanted in you. There's a lap band. There's a gastric balloon that can be done. They're kind of going by the wayside more, but they still are available as an option. And as I mentioned before, you can't out Ozempic a bad diet, but Ozempic can help. We're seeing all kinds of very promising advancements with weight loss in the medical side, in the pharmaceutical side. Now, it's wishful thinking to think you could just take that shot and never exercise and never eat anything healthy and that you're going to be fine. No, and there always is, always, there's no side effects to eating a healthy diet, but there are side effects to medications. So sometimes it comes down to the good, better, best scenario too. Medications can be good, but it's better to have medication and have a good diet, and it's best to really only have a good diet. But sometimes it requires more. So there are medications becoming available more all the time. And then there is bariatric surgery. So full disclosure, in 2021, I absolutely had bariatric surgery. Did I lose all 150 pounds because of bariatric surgery? Absolutely not. But can I claim that I only lost my weight because of intermittent fasting and a lower carbohydrate diet? Absolutely not. My obesity was multifaceted and is multifaceted. Therefore, it has required a multifaceted approach. I did take Ozempic for about 6 months after my 1-year anniversary from bariatric surgery. I'm not on it anymore. I've been off of it for quite a while, and I have experienced zero regain since being off of it. But that's because of lifestyle and behavioral changes. I've done the work up here, and I'm doing the work every day with food choices. And therefore, my obesity is completely controlled. And I'm able to take all these things that I've learned and to help you. And so bariatric surgery, we could, and I probably will do a whole video on this, but it absolutely gets a bad rap. People think like you're taking the easy way out. Well, I'm here to tell you emphatically that that is not the case. And most people, I don't even have typical results for bariatric surgery. Now, 89% absolutely see an improvement in their life expectancy just by having the surgery alone, just by even losing a little bit of their weight and keeping it off. And 95% of patients interviewed 1 year after their bariatric surgery will tell you that they've had a huge increase in their quality of life. That alone means something, guys. I have multiple sclerosis, and anything that I can do to increase my quality of life is a very, very good thing. And it's a thing that I would absolutely encourage if someone is the right candidate. Now, having said that, doing the deep dive into all of this and being members of probably 15 or 20 different bariatric groups very regularly for the past 4 years, as I've done research into this, I can tell you, again, my results aren't typical. And the majority of those groups are people saying, help me. I had this surgery. I lost a little bit of weight, but I never made it to goal. Or I've gained all of my weight back, or I've gained half my weight back, or I've gained some of my weight back. But the majority of the conversation that's happening in these groups, and these are worldwide groups, are people who fell back into old ways, who ignored the advice that was given by their dietitians, or maybe they were just given really bad advice and they're remaining obese, or they maybe, got their BMI down into normal for like a minute and then they're back. So there isn't any one easy fix. Nothing about any of this is easy. And it is exactly why your likelihood of doing this on your own is very low, and you do need someone like me to help you. And I will always be making these videos to help you. And I want to help you, and I want to help future yous. If you're a mom or a dad or an aunt or an uncle or a grandparent, if you have other people in your life younger than you, and I'm talking about kids and grandkids here, let's work together on obesity prevention. We work so hard to stop kids with the DARE program of doing drugs in school or drinking or smoking cigarettes. And it's important to prevent those things, but we're not actively trying to prevent obesity that much. And in my Facebook group, the Coach Kathy Facebook group, if you would like to join, it's called Down 150 Pounds with Coach Kathy, just like this YouTube channel is. And probably we're going to see all kinds of comments down below this video too. I see so many of you saying food choices that you're making, but you have to go make something else because your kids won't eat it, or your husband doesn't like it. So you eat this and you eat off to the side, but your kids and your husband don't like it. And I implore you to not continue the cycle of obesity onto your children. Is it totally your fault if your child becomes overweight or obese? No. But the reality is type 2 diabetes isn't even called adult onset anymore because they're seeing it in 8-year-olds. 8-year-olds do not prepare their own food. 8-year-olds do not go grocery shopping themselves. Most 8-year-olds do not pack their own lunches themselves. So at some point, we as parents or grandparents or caregivers or whatever, we need to assume some responsibility that we actually are part of the problem. And we're not all of the problem, but we could be part of, and sometimes a very big part of the problem. So let's take the time today to take all this information in and know that if our body's going to be working so hard against us to stay obese, let's not put that onto someone who is not yet obese. And if you are a family member that is trying to lose weight, and maybe you're watching this because you want to be supportive of your partner, let's stop shaming people for taking what we consider the easy route. Let's stop shaming people if they are on an obesity lowering medication, or if they have had bariatric surgery, or if they are trying to diet. Funny things happen when we try to make better decisions for ourselves when it comes to our diet. I remember when I first became pregnant with my first child, I had all kinds of advice from very well-meaning people on how to handle my pregnancy. But that is nothing compared to the advice I've been given on this weight loss journey. You're going to hear and be told so many awful, awful pieces of advice, awful things from junk science or just myths. It's just unreal the amount of information that's out there. And that's why, as a weight loss coach, I've done the deep dive. I've read the books. I've listened to the podcasts. I've watched the documentaries and the YouTube videos from other surgeons. I do have my Bachelor of Science, which included nutrition classes. I've done all the work so that you don't have to do all that. You probably don't have time to do what I've been doing for the last 5 to 10 years. And so that's why together here on this channel, we can start breaking apart these things and separating fact from fiction and coming up with a game plan on how we can control obesity once and for all and hopefully prevent it for future generations. So if you like this video, if this kind of hit home, if this was a little uncomfortable to watch, or if you're discouraged, let's talk. Give me some comments down below. Tell me what you want to see in future videos. Tell me what you would like to see for recipes even. I'm going to be posting all kinds of quick little demos here. When we know better, we do better, and we can do this together. Rome wasn't built in a day. This might be a bit of a slower journey, but that's okay. And I just wanted to leave you with a little quote that I came up with today before I was making this video. And I've already said it in the beginning, but it's if it's fast, it doesn't last. Slow is the way to go. Don't belittle small starts and small changes. Try to be 1% better than you were yesterday. 1% over time makes huge results. And if you've seen my before and after pictures, that is the thumbnail picture for my YouTube channel, then you know that those results can happen. This is possible, and I'm here to help you. So hit like, hit subscribe, hit that notification bell, and let's beat obesity together. Thank you.